Hello everyone, my name is Brian Fean. I work at Fean Physical Therapy. I'm making this program in early April 2020 during the height of the coronavirus epidemic. A lot of people can't go out and they're not able to be as active, so I was inspired to make a couple of videos. I see a lot of seniors in the community and want to be able to provide options for exercises for them to be able to do even if they can't get out to a facility or to see their physical therapist. These exercises require a basic level of physical activity. They include range of motion in all different joints. Try to go through the full range of motion in all your joints from your head down to your toe and work all the major muscle groups. It also includes balance. These are specifically the most important 20 exercises, I would say, to help keep you functional and safe in your home. Please let me know what you think of the video. I'd be happy to get any feedback, and if there's any additional videos that you would request, I'd be happy to make. Thank you. So let's get started with the older adult basic exercises. These can be done anywhere. All you need is a chair. First, we're going to start sitting nice and tall with some neck stretches. Stretching over to one side. Hold it there for about 10 seconds. And go on the other side. And then rotating side to side as far as you comfortably can. Go to the point where you get some pain, but don't push through it. A lot of people end up losing rotation as they age. Especially notice them when they're trying to drive and look over their shoulder and their blind spot. Now hands on your knees, and we're going to reach up and down as high as you can 10 times. As you reach up, look up at your hands, try to reach up as high as you can. Seven, 8, 9, 10. So with these exercises, I want to rotate from getting you sitting to getting you standing. Now and get you up. You need to use your chair for balance. You're welcome to if you need it. If you don't need it, you want to do as much as you can without any of that exterior support. So going up and down on your tiptoes. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. All right, and then we're going to do squats. You're coming down, come back up. We're going to do 10 times. Think about keeping your knees over top of your ankles, bringing your bottom back behind you like you're going to sit back into a chair. You can bring your hands up in front like I'm doing here. You can keep it out to the side and coming down. Give you the side angle where you're trying to get your hips back behind you, like you're sitting back in the chair. My knees are staying right over top of my ankles. 10. All right. So we'll come back into the chair. Sitting in the chair, we're going to do some leg kicks up and down as far as you can bring your foot up. 2, 3, 4, 5, 6, 7, 8, 9, 10, and 10. All right, now we're bringing your knees up and down. 1, 2, 3, 4, 5, 6, 7, 8, so alternating between the sitting and the standing. Next, we're going to do lunging. Put your feet on a diagonal, about a foot in between on 2 different railroad tracks, bending your knees up and down. 2, 3, 4, 5, 6, 7, 8, 9, 10, and switch. 1. So these are important muscles. These are the muscles that you need to get up a step, get up from a chair, get up from the floor. So squats and lunges are good activities to do each day. Trying to take you through a variety of range of motions, getting your joints moving in all different directions. It's going to help keep you functional and doing what you enjoy doing. So along that idea of moving around and getting through different motions, we're going to do some rotations where you're turning your hips and your shoulders and even your neck. So trying to look back behind you as you're turning. Alright, we're going to come back into the chair here. And you're going to actually rolling your shoulders back and forward. Big circles. 4, 5, 6, 7, 8, 9, 10. Alright, and give the arms a rest. Now we're going to get the legs going. Lifting your leg up and making a circle with your leg. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Switch to the other leg. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Alright, standing up. If you need to hold on to your chair, use that for balance. You want to use as much balance as you need, much support as you need to keep yourself safe, but as little as you need to challenge your balance. So hold on. If you can do it without holding on, that's great. If you need one finger, use that. If you need the whole hand, use that. Alright? So lifting your knee up and down. 2, 3, 4, 5, 6, 7, 8, 9, 10, 10. All right, now we're going to go back behind you, keeping that knee straight and reaching that leg back behind you. It's a small movement, works the back of your hip. Again, very important muscle getting up out of a chair. Alternating back and forth. If you can do it without holding on, that's even better. You're going to work your balance as you're standing on one leg. Alright, now back to sitting. We'll do ankle pumps where you bring your foot up and move your ankle up and down. This is good to keep the motion in your ankle. A lot of people end up losing that motion where you pull your toe up towards your shin as they mature. And make sure you keep that motion. It also helps to pump the calf muscle and keep that strong. That's an important muscle for the circulation in your legs. Switch legs the other side. And then we're going to stretch the low back out, bending down as far as you can, trying to touch your toes. If If you can't touch your toes, that's fine. Go down as far as you can. Reach your ankles, reach the top of your socks as far as you can get. Going up and down about 10 times. You can reach down between your knees. You want to go outside your knees, that's fine too. So we're stretching the low back out. This would benefit a lot of people that have low back pain. Good, and get you standing up again. Now this one you might need, again, you might need balance for. I got my chair here in case I need it. What you're gonna do is bring your feet really close together. I'm back here so you can maybe see my feet. So my feet are close together, and then you're trying to sway as far as you can to the right and the left. Your toes are gonna curl up a little bit. The further you can reach outside of you bring your base of support past your center of gravity, the harder it is to balance. I'm not just trying to do this, I'm trying to stay up like a stiff board or pencil and going side to side. Also helps those strategies in your knees and ankle. Now we're going to do it going front and back. I'll show you from this side here. Feet are together. And you're leaning forward as far as you can. This is not a special effect. Just trying to lean back. A lot of my clients I see when they fall, they do fall backwards. So slowly going back and forth. You can get to that area where just about the tipping point, you feel like you're going to lose your balance, and try to hold it there for 5 seconds. Balance is very important. In the older adult population, there's a lot of falls, cause fractures, hospitalizations, and it's a lot to recover from. Next balance exercise called a tandem stance, standing with your feet close together and just balancing right there. I'll admit that's pretty tough for me too. If you can't stay balanced in that position there, bring your heel next to your toe. I think that's probably a good, challenging, not too easy, too hard activity. Balancing there. If that's too easy, close your eyes and try to balance with your eyes closed. You're immediately going to feel your toes curl up, your ankles kind of twist and turn. That's what you want to show that you're challenging your body. And as you challenge your body, as you challenge your balance, you're going to help to improve it. If this is too hard, you could take a step out, almost into like a lunge position where your one foot is an inch to the side and forward of the other foot. Again, to make this more challenging, if you close your eyes, that's going to make it harder. All right, we're going to switch sides and go to the other foot. So I'm going to do heel next to my toe, holding that there. If that's too easy, I'm going to close my eyes. That makes it it makes it challenging for me. Now open your eyes if you haven't already. You can use the chair if you need to for support. Use one finger if you can. And then if you're still balanced and safe doing it that way, try turning your head side to side. That'll throw off your balance too. It takes out the vestibular system inside your ear, so you have to rely purely on your vision and the feedback through your legs. Let's switch feet, and I put the other leg back in the front. We'll try a similar type of activity. Chin up high, turning your head side to side. Make it really hard. You can close your eyes while turning your head. All right, good. So back in sitting, give our legs a little bit of rest. We're going to keep the arms going though. Sitting up nice and tall, hands out, squeezing your shoulder blades back together. So squeezing the shoulder blades together. Don't let the shoulders roll up. We're not pinching up here. Try to keep the shoulders low as you bring them back together. Now arm circles. Well, if you can see me all in here. Look this way. You're rolling yourself back. 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Take a deep breath. Bring your hands out now, palms down. And rolling forward. 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. All right, get you standing up. Got a couple more here. Strong finish. Keeping your knees straight. And we're going to lift your leg out to the side. 2, 3, 4, 5, 6, 7, 8, 9, 10. All right, now switch legs. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Again, I want you holding on if you need to for safety and balance, but if you don't need to, I want you to challenge yourself, so I want you to use as little support as you safely can. All right, the last one is going to be knee flexion. So you're just bending your leg. We're going to alternate back and forth. Give you the side angle. You're also getting some balance in here. Make sure you stand on one foot. Use a finger or two if you need to for balance. Good, very good job, great job. Have a seat, grab a drink of water. Did an excellent job with the video. Hoping to make some more of these. Let me know, please give me any feedback on what you'd like to see, what you enjoyed, and any suggestions for future videos.